So in today's video, I want to show you some simple things that you can do with a massage gun to improve your plantar fasciitis pain and symptoms. But the strategies that we're going to employ is that we're not just going to go after the symptoms that you feel, but we're also going to use a massage gun to try and find some of the broader underlying causes of those symptoms to try and help you fix that plantar fasciitis for good. With any massage gun, and this being the C2 massage gun from Bob and Brad, they were good enough to send me through one of these to test out for myself. It's really important to understand that massage guns in general, much like general massage or acupuncture or dry needling and things like that, are very unlikely to fix your specific symptoms outright. They're very useful, symptomatic, strategic things that you can do to instantly improve your symptoms. But like most of these devices and these techniques, they don't get to the reason behind why those tissues become tight and dysfunctional in the first place. But what we can do with a massage gun is we can actually go looking for some of those additional issues, but it goes without saying that if you're not also trying to figure out the underlying cause of why your plantar fascia has become sore in the first place, then it's unrealistic for a massage gun or any other treatment technique or device to magically fix your symptoms forever and not have them potentially come back again in the future. So with that being said, thanks again to Bob and Brad for sending me through their C2 massage gun, and let's get into it. So when trying to understand the mechanical cause behind why your plantar fascia has become sore in the first place, we can't just think of it as a plantar fascia issue. We've got to think of it as a broader leg dysfunction of which the plantar fascia isn't enjoying the environment that it's in. And for me as a physiotherapist, some of the things that I keep an eye out for when assessing someone for why their plantar fascia symptoms are there is we can do a lot worse in looking at how you stand and walk. If you are someone who, when standing and walking, has your feet turned out, then this can fundamentally change the orientation of all the tissue in your leg, of which the plantar fascia can be right in the crosshairs. So if you are someone who walks with your feet turned out, what we tend to see is that instead of walking through your toes, allowing your arch to be in a good position, with your foot turned out, we tend to then walk through the arch of your foot, asking that to collapse and overload that plantar fascia. So one of the simple things that you can try is just try and get into the habit of trying to stand with your feet dead straight. When you're walking, imagine that you're walking through that second or third toe as opposed to walking through that big toe. And by doing so, we can start to put that plantar fascia in a nicer environment while we get to work on mobilizing some of the restricted tissue that can create that dysfunction. As we'll get to in a little bit, anything above your plantar fascia, whether that's your calf muscle, whether it's the muscle that runs up the inside of your shin, or more broadly, if you're tight in the tissue at the front of your hip or the back of your hip, this tissue can be something that your body has to work around in order to complete the same task. So as we use the massage gun to hopefully release and address some of the restricted tissues that you may have, keep in mind that your plantar fasciitis is unlikely to just be a plantar fascia problem. It's more likely to be a consequence of something more broad. So the first and most obvious thing that you can do with a massage gun is to go after those specific plantar fascia symptoms underneath the base of your foot. What we want to look for is that we know that the plantar fascia runs from the base of your heel all the way up towards the ball of your foot. So anything in between those areas that you can gently and respectfully put some pressure on with the massage gun can, in theory, encourage that tissue to normalize just that little bit more. And what I encourage people to do is that you don't just want to blindly roll the gun up and down your foot and hope for the best. You want to take your time, deliberately and systematically work around the inside portion, applying a little bit of gentle pressure to assist with that massage effect. And then just gently sort of work your way up and down the base of that heel, looking for anything that feels tight, stiff, or tender. If you find something that feels a little bit tender, then you can spend a little bit more time on that spot, just gently working that out at the same time. We don't just want to leave the massage gun there and let the head do the work for us. We can encourage that tissue to free up a little bit faster by incorporating some gentle movement at the same time. And just keep working in and around the arch of that foot, around the base of that heel, around the front aspect of that heel as well. And then coming down towards the foot, also towards the outside of that heel. And again, for me and a lot of people for that matter, you can tend to be more tender and restricted and tight and lumpy through the inside portions of that heel. This is often a consequence of the biomechanics that underpin why a plantar fascia has become sore in the first place. And while you're working through this plantar fascia tissue, it's really important to understand that your plantar fascia serves a purpose. It's there for a reason, and any dysfunction within that plantar fascia also has to be there for a reason. Mechanically, that plantar fascia forms what we call a windlass effect, where when your big toe extends extends backwards, the plantar fascia itself becomes taut. As long as your arch is up in a good position, it allows us to create a strong, rigid yet springy platform that you can propel yourself from. And what we see with a lot of plantar fascia dysfunction is it's also generally associated with arch dysfunction at the same time. And that can generally be an arch that collapses or overpronates. But the idea is if that arch does tend to collapse, then it short circuits that windlass effect, ultimately changing the way that you load that plantar fascia tissue up every repetition you take, whether you're walking, running, jumping, etc. So again, if you're just using this massage gun to go looking for some of those plantar fascia symptoms and you're not looking to address the reason why your arch or your plantar fascia has become dysfunctional, then as good as this massage gun is and as good as it feels, you may never actually get to a point where you feel like you don't have to keep doing this forever. So once you spend some time working up and down the length of that plantar fascia, up into all the little nooks and crannies that might feel a little bit tender and uncomfortable for you, we can then go looking for other things that might be contributing to why that plantar fascia has become dysfunctional. So once you spend some time trying to mobilize and improve the function of that plantar fascia specifically, we can start to go looking further up the leg for strategic areas that, when tight or restricted themselves, can change the way that you load up that plantar fascia. The first one of these is the calf muscle. Any tightness that you accrue in the calf muscle itself can pull a bunch of slack out of your ankle, out of your foot. You can ask your body to work around that calf tightness, potentially collapsing that arch and loading up your plantar fascia differently. So with your massage gun, we can go looking through the inside of that calf muscle as well, from the top just below the knee, all the way down towards your Achilles, towards some of the tissue at the base of that ankle, for again, any clues of things that might be tight and restricted as well. Now, if you're at the back of that leg, you're going to definitely be hitting some of the gastroc and the soleus muscles, which are the two main calf muscles. But if you do come onto the inside a little bit more, just behind that shin bone, there's a muscle that we call the Tibialis posterior, among other muscles as well. And these muscles run down through the side of your leg, and some of them influence and anchor to the arch itself. So if these muscles on the inside of your shin are also tight at the same time, it can change the way that you load that plantar fascia up, leaving it open to becoming sore and uncomfortable. And if you have some plantar fascia dysfunction, I'd almost be willing to bet that on the inside of that calf or inside of that shin, especially in that lower third as you get down towards the ankle bone itself, you might find some genuinely tender and tight tissue that you didn't realize was there. So taking the same approach that we did through your plantar fascia, we don't just want to roll it over the top of the skin. We want to gently try and sort of indent that skin with the head as well to try and prompt that tissue to mobilize faster. Once you spend some time working up and down the inside of that, and that feels a little bit tender for me, we want to make sure that you're not on the bone. That won't feel nice for you. But once you spend some time freeing that tissue up, we can then move a little bit more posteriorly, a little bit more towards that Achilles, that soleus muscle, some of the calf muscle as well. Again, going hunting for anything that doesn't feel normal for you. And once you spend some time there, the other thing that we can look to do is we can go looking down the outside of the shin as well. Again, tightness in these areas may change the way that your calf and ankle function, ultimately short-circuiting that arch and contributing to that plantar fascia soreness that you are dealing with. And once you spend a little bit of time freeing up that tissue, you should automatically feel like there's a little bit more freedom, that maybe the lower half of your leg feels a little bit lighter. And then when you walk around, perhaps you don't have as many of those plantar fascia aches and pains as what you did before. And then the last place that I think you need to consider if you're trying to solve that plantar fascia dysfunction long-term is to actually go looking at what's going on through your hip. It often sounds strange that because your pain is under your foot, that if we're actually talking about your hip, it sort of feels like it's quite far away from where your foot is. So intuitively and instinctively, it may not make perfect sense that mobilizing any stiff hip tissue might influence the function of that arch and that plantar fascia. Any restrictions up at the front of that hip or at the back of that hip can ask your body to work around that restriction for every single step that you take, fundamentally changing the way that you load up your entire leg, of which a collapsing arch or plantar fasciitis can be a consequence of. So with your massage gun, where the bone is at the front of your hip, if we come just on the inside of that, we can basically work our way up and down that area, looking for anything that feels uncomfortable and tender for you. We can work down onto the thigh, any of the tissue, again, that feels tight and restricted. Spend some time trying to free that up. Make sure that you're not putting pressure on anything that feels uncomfortable. Again, don't go over the hip bone itself. It won't feel nice. You don't need to be there. Spend a little bit more time on any of the spots that may feel a little bit gristly and a little bit more tender than you may have experienced previously. But ultimately work your way through that, paying close attention to what needs that TLC. And once you spend some time around through the front there and hopefully feel like the front's just loosened up a little bit, we then want to work our way to behind the hip bone at the side. Once you find the hip bone at the side, directly behind that tend to be a lot of our hip external rotators, the piriformis, a lot of the deeper hip muscles that turn your foot outwards. These can become tight. And again, if you are compensating for this tightness, then your whole leg can do something different than what it's designed for, ultimately changing how that plantar fascia feels. So again, I'm coming up a little bit higher towards some of where those traditional glutes might be. It's a little bit of a tender spot here. Just gently working my way through there, consistently putting some pressure through there, imagining that I'm massaging this tissue first, not just running a vibrating object across the top of it. We want to use the vibrations as a bonus almost and get some massage out of that ball to encourage that tissue to mobilize and free up. One of the interesting things that I'm finding as a physiotherapist is that the sciatic nerve that comes from your lower back comes through that piriformis, goes straight down the back of your leg and branches off then into your calf, can potentially have an impact on the function of that plantar fascia as well. So if you're finding that there's particularly tight and tender spots through here, I'd be very interested as to how you feel as to once you can free up and encourage this tissue to settle. If you get the massage gun into these areas and you can feel looser for this, you may then expect to walk around and see an immediate difference in how that plantar fascia feels. But again, as always, and as we mentioned at the top of this video, just doing this alone isn't good enough to cure your symptoms. You may need to strengthen your calf muscle, you may need to strengthen your glutes, you may need to work on your core strength or your general posture, you may need to mobilize a stiff ankle joint, you may need to mobilize a stiff hip joint, all things that general massage and massage guns can't do specifically. And although these can feel really nice and definitely add something to your rehab program, you've got to make sure that you're taking the time to work on the other things that are complementing this dysfunction. Once you spent some time going all the way through there, you should then feel like there's just a little bit more range of motion for you to play with. And then when you stand up and walk around, hopefully you'll feel that your plantar fascia isn't as aggressively sore or uncomfortable as it was before. So as always, I genuinely hope that was helpful. And I hope I can provide you with a little bit more insight to how to treat and resolve that plantar fasciitis long term. If you're in the market for a massage gun, consider picking up the C2 massage gun from Bob and Brad. If you're interested, I'll leave a link in the description with a discount code to this very product. And a big thanks to Bob and Brad for sending this out to me to test out. It does feel nice to use. And please let me know in the comments down below which one of the areas that we got to was more tight and restricted and tender than you may have realized beforehand. And obviously how you felt the gun worked on those areas. But once again, thanks for watching and I hope to see you in the next one.